Techniques to improve eversion and inversion are similar to those that we used to look at mobility and get to the end range previously. If those techniques are unsuccessful, a subtalar manipulative technique in order to regain eversion or inversion may be attempted, so that when we have reduction of movement over time and they've been unsuccessful with mobilization, or we identify a sublux joint, we might want to go into one of these techniques. Again, with each of these techniques, we want to make sure that the person does not have a cold or a clammy foot, which may be indicative of neurological or vascular compromise. And we also want to make sure that we are protecting some of the soft tissue structures and other ligamentous structures, so we have to be cautious about that. To regain subtalar eversion, the subject is going to be laying on their side, and the therapist will sit down with the leg wrapped around on their leg. The therapist's thumbs will identify the sustentaculum tali and place a stress to the sustentaculum in towards eversion without blocking on the underside the movement of the calcaneus. A stress to this joint is placed as a pre-manipulative hold to see how well the patient can tolerate that stress. Once given the okay, the therapist will take the leg and move the foot up and give a slight drop and quick flick onto the sustentaculum to move the joint. Once again, lift it up and give a quick flick of the thumbs onto the sustentaculum. To perform a manipulative technique to restore inversion, turn to your other side, please. The calcaneo-cuboid joint line is identified. With the thumbs, this joint line is approximately at a point where a V, which you can see slightly as the calcaneus and the base of the fifth metatarsal come together. The bone in between is the cuboid. We identify the front of the calcaneus. And again, we're going to place our thumbs and provide a bit of stress towards inversion. And again, ask our patient if they're okay with that stress. If they give their approval, we're going to take this foot and again lift up and give a quick flick onto the front part of the calcaneum in a medial direction to restore inversion.